The National Union of Disabled Persons of Uganda, NUDIPU, is calling on the government of Uganda through the Ministry of Finance, Planning and Economic Development to allocate a supplementary budget for the rollout of the Child Disability Benefit. According to the 2024 National Population and Housing Census report, there are 460,805 children living with disabilities in Uganda, making them one of the most vulnerable groups in the country.
In advocating for this child disability benefit, the idea is that it should have actually come through in the budget itself. But yes, there is a provision to actually provide for supplementaries over and above the approved budget. And this is usually passed through Parliament. And as the CEO has indicated, we are trying to take advantage of that window where they provide for a supplementary budget to be able to push for the child disability benefit.
Earlier this year, through the Deputy Speaker of Parliament, Thomas Tayewa, the government was urged to commit 12 billion towards supporting the initiative. However, the child disability benefit was not included in the recently read budget for the financial year 2025-2026. The union is calling for fulfillment of this commitment towards aiding children with disabilities.
I want to emphasize the 12 billion that was committed by the Speaker of Parliament, because we want to do a pilot, we want to start. As we start, we want to learn lessons, see what more we need to advocate for, and because the needs are many, and we may not say we want 1 trillion, yet we have not even started. So for now, we calculated that if government supported 10,000 children with disabilities at a rate of 100,000 per month, this is the 12 billion that we are talking about. And we think that these 10,000 would be like a learning for us to know what more do we need and how much money do we need to address the challenges we are finding.
Children with disabilities and their families face poverty and social exclusion due to such as reduced ability to earn an income because of caring responsibilities, additional cost of accessing health, education, among other factors. Thus, the need to ensure a budget is catered for them.
The challenges that persons with disability and the caretakers face is really big. We very well know that in most cases, the parents of children living with the disability find it challenging because of the multiple expenses that they incur, from treatment to education. You remember the distances from schools to their homes is a bit challenging, and at the same time, even accessibility to health services is a bit a serious issue. Even the hospitals that are constructed do not take into consideration the needs of persons living with disability.
Susan Sabana, the program officer under the umbrella Cerebral Palsy Network Association, mentioned some of the challenges that children living with cerebral palsy undergo, emphasizing the need for a supplementary budget.
This condition, it can vary in severity, but it often requires ongoing medical management, including medications, physiotherapy, occupational therapy, speech therapy, and sometimes surgery. Urge the government to allocate specific funds within the disability child benefit to address the needs of these children living with cerebral palsy.
They further appealed to the Parliamentary Budget and Gender Committee to champion for this cause.
As a forum, we are advocating too much, and we want that members of Parliament to support this child disability benefit. We are engaging with different ministries. We engage with the Ministry of Gender, Labour and Social Development, and also we are going to advocate with the Ministry of Finance to help to include this child disability benefit in supplementary budget. Thank you so much.